Hello. So today's topic is what is sleep apnea? So sleep apnea is a problem that people get while they're asleep. So apnea is a medical term that means not breathing. So so how does this happen? So basically, when you go to sleep, every part of your body relaxes completely. So this includes the tissues in your nose, in your throat, behind your tongue, and throughout your upper airway. So in most people, there's plenty of room in these areas for air to keep moving, even if the tissues in those areas relax and things narrow down a bit. In patients with sleep apnea, at least one or more of those areas in the back of the throat and the mouth are so narrow that when they go to sleep and when these areas relax, they can actually close off completely during breathing. And you'll have periods of not breathing, which are called apneas, or you'll have periods where there's a very limited amount of air moving. Those are called hypopneas. So that's what sleep apnea is. So what are the typical complaints of someone who has sleep apnea? So normally, they may not be aware that they're waking up overnight, but they're snoring loudly, and they're having very, very poor quality sleep. The reason for that is their brains realize that they're not breathing well, and their brains are forcing them to kind of halfway awaken over and over again throughout the night to breathe properly. So as a result, people feel very tired during the day. People will a lot of times wake up with headaches in the morning, sore throats, and just during the day have kind of a brain fog where they have trouble remembering things, trouble focusing or concentrating on their work during the day. And in severe cases, people can actually fall asleep in their car at a red light, or just sort of nod off if they're just sitting still, not doing anything for a few minutes. So sleep apnea, it's not just a nuisance type of problem. It is a potentially life-threatening problem. Not so much in the short term, because again, people will stop breathing overnight, but their brains will keep sort of waking them up enough to breathe. The problem is over time, if this sleep apnea is not treated, there's a significant increased risk of serious life-threatening problems, like heart attack, like stroke, and even sort of brain problems like Alzheimer's disease. The risk of all of these things is at least triple and sometimes even 5 to 7 times higher in people with untreated sleep apnea versus people without the problem. So, if you're someone who has loud snoring, tiredness during the day, any of these things that we discussed, I would recommend you come in and see me. We can test you and see if you have this problem or not, and then we can hopefully treat you and get you sleeping better and feeling better. Thanks.